started the contract on the 1st of April 2020 in the midst of COVID, and we did the installation within the first 6 months of the contract. So it's a total bed management contract. It encompasses 4 sites, so we have St Bart's, Royal London, Newham and Whipps Cross. We have 4 teams working across the sites, 24 hours a day, 365 days a year. Linet and Bart's have got a fantastic working relationship. We've built that relationship over the past 5 years.
We collaborate with a few different teams, but as a whole we have a look at each patient individually to look at their needs and their requirements during their stay in hospital. So through the products that we supply, we have bariatric beds, we have some low beds for our high falls risk patients. So we're able to supply those beds and specialty needed equipment as required to allow for patients to get their best treatment while in hospital.
We have got our Rentline system, which is an online portal which the wards use to request all their equipment. Our guys in our bed store here will receive that request on their PDA, and then we will deliver that piece of equipment for them. So once a patient's been discharged, the ward staff will go onto the Rentline system again, and they will request a collection. Our staff will go out to collect that piece of equipment. They'll bring it back, and then they will decontaminate the piece of equipment in the decontamination area, make sure it's fully decon, tested, and then repacked, rescanned, and ready for the next patient.
We moved into this new ITU, working with Linet, who kind of proactively thought about what we needed before the day and providing us with the beds. Servicing the old ones, taking them away was a big help for us and was very, very beneficial. It's definitely useful to have that expertise and that knowledge and that ability for us to reach out and ask for help when we need in a timely fashion.
The benefit of the collaboration we have and the type of contract that we have and the uniqueness of it with Bart's is that because it's a whole service package and because we have clinical staff on site that are able to assist the nurses 9 to 5, Monday to Friday, and even out of hours. So it's one less thing for the nurses on the wards to worry about. So I think for me, just seeing the benefit to the patients, having a whole encompass contract does the benefits of it.
We are very pleased with the Linet, basically I have to say that, because we had the old bed for a long time. So when we moved to Linet, we had a very good support from the team. So what are the advantages of that using? So they come and educate. So expertise are really good. If we have any problems, we can call. They are in the site to help us actually. So we are very happy with their support.
The main thing for us is just to provide the hospitals with the products and the services that they need. And the way how we have at each site all of the products that's necessary. They don't have to go outside to hire in third-party equipment. We are there to provide, and we have the stock ready to go once they need it.
One of the focuses from Bart's when they started the contract was the response time. They wanted a supplier that responded quickly. So we have strict KPIs that we have to meet, and we're really proud of the fact that we have met those KPIs 99% of the time.
We've been a great partnership. The patients are happy, receiving exactly what they ask for or what they need. The staff are receiving the service exactly what we need. Prior to the contract, where there wasn't any transparency, lack of equipment, lack of appropriate equipment and provision. And now I can gladly say that Linet, from day one, meeting all the KPIs, all the requirements. We've got a fantastic team across the hospitals. We've got a fantastic contract manager in Nat. The finance team in the background that's sending invoices and back and forth. We've got the admin team, help desk. We've got the people on the shop floor, the engineers, as I mentioned, the technicians, the clinical nurse advisors. They are the superheroes. They are straight away there at the bedside next to the patient, looking at what the needs and wants are and delivering exactly what the patient needs are.
Teams are excellent, very friendly, very helpful, and that's what you need, because actually things do go wrong in hospitals, the big places, and the last thing you need is people who get very excited very quickly. Found everybody that I work with in Linet really good to work with, and we just get on with each other and help each other out.
So the moving handling ergonomic service has worked really well with the Linet team. We find that their advice and expertise is invaluable, especially having a clinical nurse advisor on each hospital site. And currently they work really closely with my moving handling leads to make sure that we give the best patient care, we can be able to access the appropriate equipment for our patients. If there are any issues that we need to be aware about, we exchange information really well for the benefit of staff at Barts Health and for the benefits of our patients. Having that link has been really invaluable because I remember the contract before Linet and we really didn't get that much support. The difference here with Linet, they also are nurses, and so they have the expertise to give the knowledge and the advice that will make a difference to our patients.
I'm really proud of what we've done here, particularly of our staff and our teams on site. They work really hard day to day at the front end of the contract where it really matters. The whole organisation has worked really well together. The collaboration with Barts has been fantastic, and it's something that we would like to continue and replicate with other trusts.